So this morning, we light our chalice in remembrance, in gratitude, and in hope. We remember the precious lives lost to HIV/AIDS, the loved ones who still carry their names in their hearts, and the long, unfinished journey towards healing and justice. We give thanks for the healers among us, the doctors, nurses, therapists, researchers, and all who step into the room of fear and uncertainty, bringing skill, compassion, and honest presence. May this flame remind us that even in the shadow of illness, human dignity endures, love persists, and courage rises in ordinary people who refuse to turn away. As the chalice is lit, may its light be a blessing on all who seek healing and all who offer it. Amen. And now our opening hymn. With a presentation on World AIDS Day by Peter Tortorello.
Thank you, Jim. Thank you all for being at the service today. What I was thinking when I was putting this together was that there are many people that may not know the background of World AIDS Day and its importance and how this whole situation came about. So I'm going to rather quickly, I hope, just kind of run through a few of the facts so that you know what they are. The World AIDS Day is a day of remembrance, resilience, disruption, and recommitment. It's December 1st of every year. It started in 1988. When it started, the epidemic had been going for 8 years in the gay community, and Ronald Reagan totally ignored it for the whole period. It wasn't until 1987 that he even used the term. But during that time period, the community came together to care for the thousands of people that were sick and dying. Locally here in our area, organizations like ACT UP got organized here and across the country. Test Positive Aware was a publication that came out of Chicago and was distributed over in Western Michigan. Programs like the AIDS Alternative Health Project started up with more holistic approaches. CARES in Southwest Michigan is an organization that we support, and they did a tremendous job of starting to support people. And for those people that were homeless, places like Chicago House were organized and put together to take care of people that had no place to go. None of these institutions, organizations had any funding from the federal government, but they were to a great extent funded by the gay LBGTQ community at that time and some corporations. As all of us know, AIDS is caused by the HIV virus, which uh, um, suppresses your immune system and allows opportunistic infections to uh, affect your body. In 1980, doctors were seeing gay men in New York who were getting a strange disease called Kaposi sarcoma, which generally affected older men in the Mediterranean area. It was a cancer that attacked the blood vessels. At the same time, on the West Coast, we were seeing people getting pneumocystic pneumonia, which is uh, a viral kind of pneumonia that were killing people. No one at that time knew what was causing it. Time Magazine put out an article after the CDC had announced a task force. Now, this is around 1980 that this pandemic was spreading. A few years later, the CDC officially coined the term AIDS, acquired immune deficiency syndrome, and the World Health Organization declared an international emergency. Research on the virus started with the CDC in France and across Europe, trying to find out exactly what was how this virus was working. It wasn't until 1985 that the first test was developed. So we were 5 years into the epidemic. People were dying and getting infected, and we had no way of identifying who was affected by it. It was that a few years later is when the World AIDS Day was formed. So we're 8 years now into the epidemic. It wasn't until 1996 that at the 11th Annual International AIDS Conference in Vancouver, that there was a presentation done of the anti-retrovirus drugs that were becoming available. So we're 16 years into the epidemic with no treatment for it. Uh, the UN started a program at that point to provide some support for developing countries. From 1980 to 1997, when this first drugs came out, 30 million people had died and 16,000 people a day were becoming infected. Um, it wasn't until 2002 that the Global Fund for Fighting AIDS was created, which was 23 years after the epidemic started, and they've invested over $50 million. So as of 2024, last year, 40, and now we're looking at this, and this is what, 24 years or 44 years into the epidemic. 44.1 million people have died. This year, in 2024, another 630,000 died. And they were hoping to get it down to 250,000 this year. Today, about 40 million people are living with HIV, and about 1.3 million new infections happen every day. And we probably wonder, how can we still have 1.3 million infections every day, or every year, rather, not every year happen, when we know so much about the situation? And here's why this crisis continues. Currently in Washington, the administration pulled out of the World Health Organization, cut funds for domestic prevention programs, including education, prevention, and research grants. They pulled out all the foreign aid, or they have it on halt, which is going to allow up to 20.6 million people to become infected that may not become infected. And USAID was international funding was pulled out by another 60%. This is likely to cause a huge resurgence in Africa and in Southeast Asia. In the United States, CDC research has been cut. PrEP drugs, which are now available that allow you to prevent people from getting infected, drugs like Biktarvy, which you see on TV and cost about $1,600 a month. Funds for those are being cut back. Education at all levels are being cut back. And a big part of preventing infection is informing people of what causes it. And counseling services are also being taken away, again, causing a serious opportunity for resurgence in the United States, in minority communities, in rural areas, including in Southwest Michigan. So what can we do about all this? First of all, I think we just need to know the facts and be able to talk about the 45 years now that this epidemic has been raging. One of the good things that came out of the epidemic is the COVID vaccine that we've been all taking. That the research for that came out of the CDC in efforts to take care of HIV. So we need to know the facts. We need to write our government both or not both, at the city, county, state, and national levels to get support. If we're not going to get the support from the national level, then it really does fall on the states and the counties and the local areas. And we need to support programs like CARES in Southwest Michigan, who actually are working with people to care for them, to educate them. The center also does quite a bit of this work. I'd like to those are the facts. That's what we need to do. But I also think this is a day of remembrance. So I'd like to just take a moment uh, to, as Jim said, to reflect on those that we've lost due to HIV and AIDS. Uh, I started thinking about the people that I lost, and I just want to mention a few of their names and reflect on it. Um, Frank, Rick, Aloysius, Larry, Roger, Danny, Greg, Jerry, Ted, John. And those are just a few. Most of them I grew up with from grammar school on, and some became friends as they got older. If anyone has anyone that they want to mention.
So now is a real treat for us. Dave Richardson and Danelle Hamlet are going to speak. So Hamel, rather, not Hammett. Dave, would you like to start?
You guys hear me?
We can hear
You
you.
guys?
We can hear you,
Okay,
Dave.
good. How's the volume?
Good for me, if it is for everyone else.
Okay, good. Um, I just really got to thank Buff and Peter on a number of different levels. Has personalized things to me that were just data points. I graduated from nursing school May of '94. I started my nursing education in fall of '91. As Peter discussed, I mean, the first case in the United States was roughly 1981. And by 1984, we figured out the virus that was responsible for AIDS. In 1987, we had the first antiviral, and by 1996, we had pretty good treatment. So we had pretty good treatment within the first 2 years of my practice as a nurse. And interestingly, I have actually only had one encounter with a patient with active AIDS. I was a nursing student. I answered a call light, and the individual wanted to know if he could have some more ice water. And there was a picture in his chart of an upper scope we had done, and his entire throat, circumferal all the way around, all the way down, was covered essentially with canker sores as he slowly died. So I didn't think it had had a huge impact on my career. However, I had a flashback to spring of 1990. I was taking physiology. Well, one of my fellow classmates who graduated with me actually went to my friend's church. So she and I had kind of a connection through that. And at the time, I was actually a born-again Christian. And we were discussing HIV and AIDS. And amongst the evangelicals of that time, the first time I tasted it, was their absolute joy that God has sent the gay plague on the gay community to show them that their so-called lifestyle was an abomination. It was the first huge fracture in my faith. That joy that God was punishing the sinner chilled my soul. I hadn't thought about it in at least 25 years. I have to admit, it just chills my soul to this day. From a healthcare perspective, like I said, although I've not specifically dealt with active AIDS patients, since for the majority of my career, AIDS has been a manageable chronic disease with increasingly improved treatment. But one thing that has had a huge impact on my career is Matthew 25's call, sheeps and the goats. God says to the sheep, blessed are for you, for when I was hungry, you fed me, naked, you clothed me. When I was sick, you took care of me. And when I was in prison, you visited me. I've had the opportunity to be loving towards the outcasts, be they gangbangers or people from the LGBTQ community or just poor people. I really would like to thank Peter for asking me to discuss the impact of AIDS from a healthcare perspective. And even though it hasn't had a direct impact on me, it did actually lead to me leaving Christianity because I couldn't tolerate the bigotry. But it also, that moment in that discussion, when I was chilled to the bone, was when I made a firm commitment that I would always take care of the least of these in all of their forms. Worldwide, or in the United States, there's 900,000 cardiac deaths. So, what does a few thousand AIDS death mean? It means everything to their families, everything to their loved ones. And I think the sad thing that Peter's talk made absolutely clear is the current size of a problem is not limited by technology, but by will and by compassion. Unfortunately, we think that we're saving money by not wasting it on those people who really should be able to pull themselves up by their bootstraps. They don't understand that even from a purely selfish perspective. When we take care of people, those people contribute to society. We don't have to be bleeding hearts who just don't want people to suffer, even from a selfish perspective. Taking care of people is the answer. We just need to do it intelligently. And the pain that I've experienced contemplating this speech was even made more profound by what Peter discussed about how we're moving backwards. We're going to allow disease to ravage us to a greater extent because, well, we think it's a good idea not to take care of people. So in terms of the impact as a healthcare provider, I take great joy that I have the privilege of taking care of people, especially the least of these, in all of their form. And I have such profound gratitude to people like Peter and all of the individuals who said, it's time to take care of people, specifically these people, and we're letting them down in this way. I'll try my best to work with Peter and every other person of compassion and goodwill. But the sorrow is, I know that not only is it the right thing to do from the perspective of empathy and compassion, from an absolutely cold-blooded view, it'd be so much better just to take care of people financially, as well as in the human cost. And thank you.
Thank you, Dave. That was very lovely. Anyway, thank you, Dave. And Danelle, could you come on board and speak for us?
Yes, hello. Thank you for inviting me to participate today. I was a child during the AIDS crisis, and I haven't lost anyone to AIDS, but I do want to say that there's two really important gay men from my childhood, Uncle Ted and Uncle Norbert. We were not related by blood, but my relationship with them and growing up visiting them in their home, which was a warm, safe, free thinking, colorful place, was almost like a vaccine for me against bigotry that was also really part of the strict religious community that I was part of as a child too. And so just being around them was part of how I deconstructed a lot of things. And I didn't, they never talked about religion. It was just to be around these like warm, lovely people, and see how natural their love was, and what a beautiful home they made that welcomed so many people. So I have a lot of gratitude towards that community. And just preparing to talk today, I did do a little bit of research about the AIDS crisis, and I'm sure that there's a lot of healthcare workers who are carrying a lot of heaviness from that time if they worked during that time, and maybe they want to apologize for what we didn't know and how we would have failed our patients, based on fear, based on maybe some religious ideology. I know there's people who do my job who are carrying heavy things, because I carry heavy things from, just like Dave talked about, the pandemic that we went through. I would actually like to talk today about a work injury that we're very at risk for as nurses. And learning about it was part of my healing journey after the pandemic, which I was an ICU nurse during the pandemic. I've been a nurse for about 20 years and an ICU nurse for about 13 or 14 years. And I think there is some parallels between how it would have been working with AIDS patients during the AIDS crisis and what happened during COVID, where we didn't really have anything that could help you. There was a lot of unknowns. It seemed like every week there was a new thing that may have been true, may have not been true. But specific to my experience, one of the things that I noticed with a lot of my colleagues and myself is, 3 or 4 years later, 2024, we were still talking about, I still don't feel right. Like I'm doing all the things, I'm going through all the motions, but inside I still don't feel right. And it was a confusing, like, we did our best. We showed up for our community. We worked really hard. A lot of people died. It wasn't specifically our fault. We really were doing our best, but somehow you feel this heaviness. And for instance, as an ICU nurse, maybe by about 2021, we had statistics for survival rates. And so if you needed high flow oxygen, your mortality rate as a COVID patient was about 60%. And if you needed a ventilator, your mortality rate was about 85%. And in ICU, we are really good at keeping you alive. So those deaths were really slow. Those deaths were over 2 months sometimes, on a ventilator for 2 months. And with the isolation where families couldn't see the patient, it meant that, at least for me personally, I couldn't keep my normal emotional professionalism with these patients, because actually it wasn't the right thing to do. They were alone, and I was their nurse, but I was also another human being with a person who is suffering and dying. And so that meant that I couldn't, they had to become my people in a way that a patient, like, really, that shouldn't happen every time you have a patient, because you can't carry all of that as one person. So a lot of bad things happened, and some of them felt like we as healthcare workers may have failed, or I myself may have failed. And I learned about this term, and it's called moral injury. And I don't know if any of you guys have ever heard of it. It was first proposed, I'm going to quote something, a scientific article from NIH.gov here. Moral injury was first proposed as a framework to help soldiers, veterans, and their mental health providers conceptualize experiences during war that violated service members' moral codes. Moral injury is not a diagnosable disorder, but rather considered a syndrome associated with clinically relevant levels of psychological distress. Moral injury can manifest as guilt, shame, a sense of betrayal, anger, disgust, anxiety, cynicism, loss of confidence, isolation, and can contribute to other conditions like depression or PTSD. A severe enough moral injury or a cumulative number of moral injuries can even result in a breakdown of a person's moral framework and ability for empathy. It was originally studied in military personnel, but now is being studied in the context of healthcare and law enforcement. And for healthcare workers, particularly nurses, it's just considered as a work injury that is something that's a hazard of the job and probably happens the most often to healthcare workers. So we experience a lot of potentially morally injurious events, like the pandemic. A lot of that happened. We were keeping people away from their loved ones. People were dying in isolation alone. A lot of the things that we do to preserve someone's humanity and dignity were really difficult, like just wearing a full suit of isolation personal protective equipment, and or we would wear these helmets that had air blowing to keep us safe, but it meant that we couldn't hear our patients very well and they couldn't hear us very well, and there was just a lot of separation, and it just didn't feel right. And there's other things like a code blue, for instance, where we're trying to save someone's life and we're all working together and it's very high stakes. It's really important, and actually the American Heart Association has recognized this. It's really important for us to speak kindly to each other, to actually give compliments as part of the algorithm now for how to behave during a code blue. And afterwards, it's also a part of the protocol that you have to debrief and talk to each other, and that's a way to prevent a code blue, whether it goes right or wrong, from being a morally injurious event to the healthcare workers. There's three different categories of moral injury, like three different ways that it can happen. There's commission, where you do something that is against your core morals. So an easy to understand demonstration of that would, if let's say for a soldier, they have to or ordered to or maybe accidentally kill a civilian in their line of duty. There's omission, where you feel like you should have done something and you didn't. And then there's betrayal, and that usually has to do with the authority figures around you or the system that governs your actions betraying you in some way, and a bad thing happens and you're part of it. What's different about moral injury compared to other trauma is that it's direct damage to a person's identity. It's core damage. And it doesn't mean that you can't heal from it. There's a lot of helpful things like support groups or debriefing with your colleagues, people who understand the situation. But it can also be cumulative over time. I'm not a mental health professional, and so I don't want to be too free with expanding this concept. Everything that I've read about it is in the context of it's a work injury in these jobs. But I do feel like probably more information is coming about how this is something that can happen to anyone under certain circumstances. And I feel like it's pretty likely to have happened to a lot of people in the LGBTQIA plus community. I feel like it's likely to happen in strict religious communities. I feel like it's really interesting that to receive a moral injury can break down your own system of empathy and morals. I think this is something that has helped me to untangle some things about my experience as a healthcare worker. And I don't want to have people diagnosing themselves or to be, but I just feel like it's something that's really interesting that could help to name it to tame it kind of situation. And so I wanted to share it with you guys. I just think it's worth thinking about how this kind of injury can affect people outside of professional environments. And something through what I've studied about it and the papers I've read about it that is kind of a accumulation of the advice that I've read of what you could say to someone who may be suffering from a moral injury, or what you can say to yourself if you've suffered from a moral injury, is that you aren't hurting because you're a bad person or because you did a bad job. You're hurting because you're a good person and a bad thing happened and you were there. We might need to go over some context, and maybe there are some things that you would have done differently, but you did the best you could in difficult circumstances. And like, one of the things you need as a morally injured person is for someone else to help provide context for you to recover. And I think that, like, your community, the buff community, I think is really supportive of these kind of conversations. But I think that it's for sure healthcare workers that were working during the AIDS crisis would also have experienced this. And um, I hope that they are okay. And I hope that the patients and the people who lost friends and family members, and at a time when they thought you couldn't hug someone with AIDS, and then later you find out that it was just fine. You can hug someone with AIDS and not catch AIDS. But I feel like those kind of experiences are things that can be morally injurious. And I just wanted to share it. But thank you for if you want to learn more about it, there's wonderful TED Talks about it. I can provide some links to Jim, and maybe he could put it in one of the newsletters. And also the NIH.gov has like 19 papers about moral injury. So thank you so much.
Thank you, Danelle. I think we all learned something today. And thank you both, Dave and Danelle, for informative and interesting and inspirational talks. Love my whole sermonette, even though it's very short. We are knocking on the door of 11:30, but I will read an excerpt or two from it. Anyone who has spent time talking with doctors, nurses, psychotherapists, or addiction counselors know how demanding that work is. It is often emotionally exhausting. They absorb our fears, carry our anxieties, hold our vulnerabilities, frequently while their own spirits are running low. Honoring them means not only giving thanks for their skill, but acknowledging the emotional cost of caring. I remember one occasion, an office visit with my urologist. We wandered into a conversation about the strains of his job. He said, "I feel like I'm always giving, always running, 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 running." I recognized the emotional state. I'd gone through it myself decades earlier. He was experiencing what some call individuation, the painful deconstruction of the worldview of one's youth and the slow, halting emergence of a wiser, more authentic way of being in life, or as Emerson might simply say, daring to be. During our visit, the doctor began to weep. He told me he was mostly non-observant Jew, but after marrying an ardent Protestant woman, he had become a Baptist. As I listened, I wondered if something essential had been left behind, not a doctrine or a creed, but a source, the ancient 4,000-year-old spiritual river of Judaism still running through his psyche, still shaping the landscape of his soul. I said gently, "You can't simply stop being Jewish. It's not only in your spiritual DNA, but also in your physical DNA. Maybe you need to learn to tap into that nourishing source and let it inform you about who you really are, who you need to be." I suggested he bargain lovingly with his steadfast wife for occasional visits to a synagogue, maybe a few conversations with a rabbi, or a personal course of study into his ancestral roots, something to restore his inner equilibrium, something to remind him that the deep waters of faith and renewal still flow. When the exam was finished, nearly an hour later, he gave me a big hug. And when I walked into his waiting room, it was filled with people waiting. So I'm going to jump ahead So we see it in the, okay, for my money, there's a deep truth that we often ignore. And that is something we rarely say aloud, but the human spirit has healing powers we do not fully understand. We see it in the placebo effect, where non-medicinal substances combined with suggestion bring about real healing. And what is astonishing, almost unbelievable, is that the placebo effect works even when people are told plainly, this will heal you, even though it has no medicinal relationship to your ailment. To me, this reveals something profound, what I would prefer to call the faith effect, that awakens a powerful inner dynamic within us, the healer archetype. And so I began to wonder if there was some kind of powerful incantation we could say here today that would help us to activate that that healer. So I went searching back in history into ancient wisdom traditions, into the rituals created long before microscopes and laboratories, long before the modern world forgot how powerful the human spirit can be. And what I found was not an incantation at all, but a truth so simple we often overlook. Each of us carries within us a healer, a deep, ancient archetype that rises when we allow it, guiding us towards wholeness, compassion, and courage. This inner healer doesn't need magic words or elaborate rituals. They only need our willingness to listen, our willingness to trust the wisdom that lives beneath our fears, our willingness to let the light within us participate in the healing of the world. So this morning, instead of a charm or a chant, I invite you to pause and recognize the healer already living in you, the part of you that knows how to soothe a friend's sorrow, how to hold another's grief, how to mend the brokenness in yourself, and offer strength to those around you. Can we learn to call the healer forward? Can we learn to give it room? Can we let it shape our words, our choices, our presence? For me, the truth is this: the healing of our bodies, our communities, and our nation will not come from any single institution or profession, as essential as our medical professionals are. Healing will come when more and more of us awaken to the inner healer inside and live from its wisdom, its steadfastness, and its compassion. You carry that power. We all do. And our wounded world needs it now. Amen. So close your eyes for a moment and just breathe. Settle into the quiet that gathers itself in this room or in this space. There comes a time in every life when we must stop running from ourselves. When the noise of the world grows so loud, so frantic, that the only honest place left to stand is at the doorway of our own heart. It is there on that threshold that the truth begins its slow, unrelenting work. Each of us carries wounds, some inflicted by others, some inflicted by our own fears, and some, perhaps the deepest, inflicted by forgetting who we are. The world will tell you that you are broken, that your light is insufficient, that your story is too small. The world is wrong. Beneath every bruise, every doubt, every weary hour, there's a pulse still beating, a strength, a knowing, the quiet insistence of your own being, the healer archetype alive in you. It has only been waiting for you to stop pretending that you are powerless. You are not powerless. Now, as you continue to breathe, let your breath remind you that you belong here, that you are needed, that the healer within you is not a fantasy, it is a powerful dynamic of your soul. In this broken and beautiful world, you are the medicine. Your compassion is the medicine. Your courage is the medicine. Hold this truth gently, but hold it firmly. You are a bearer of healing in a time that aches for it, and you do not need incense or ancient words to make it real. You only need to let your light shine, to show up for yourself and as yourself. Amen. It's perfect. We extinguish this flame. but not the light of remembrance for those we have lost and for those who continue the journey. We extinguish this flame, but not the quiet strength of the healers who show up day after day to ease suffering and restore hope. We extinguish this flame, but not our commitment to a world where every life is treated with dignity, compassion, and justice. May the light we kindled here shine in our hearts as we leave this place, a small but steady flame for healing, courage, and love. Amen.